Good afternoon, Victoria. As I announced on Friday, President Trump has addressed the nation, and so has Governor Abbott, with additional recommendations on a strike force and plans to reopen the economy. Today, our Victoria mayor and judge both had a conference call, but they'll be speaking about that exact topic today. At this time, I'd like to provide you today's information about COVID in our community. As of 2:30 p.m. today, we have one new case. Total cases in Victoria, that brings us to 96. Suspected community transmission is 25. Recovered is at 60, bringing us to a total active confirmed case count of 34. Once again, today we'll hear from County Judge and Mayor about Governor Abbott's updates to reopen Texas. Our Public Health Department Director, David Gonzales, will discuss the nature of COVID in Victoria, including testing data and capacity, and continued CDC recommendations upon businesses reopening. At this time, I will open it up to David Gonzales.
Great, thank you, Ashley. So like Ashley mentioned, we're looking at one new case today. If you recall, on Friday's press conference, we had done the initial press conference. There was no new cases that day. We had I believe three come in late on Friday, and then we had three over the weekend. So past 3 days, we've had now 7 new cases. What we're looking at actually past 4 days back to Friday. Again, 96 total cases in Victoria, 34 of those are active. But the encouraging piece, obviously, is the 60 that are recovered right now, and then we're sitting at 25 suspected community transmission, which we'll kind of go into a little later as far as decision-making processes later on. Keep in mind, like I mentioned, there's sometimes we have early indicators of data, but we don't get finalized data until after the press conference. We want to give it to you as quick as we can, but we want to make sure also on the other end it's accurate, the information we're pushing out. As of now, we're still designating the community as a kind of mild to moderate transmission level, and there's different factors in that. There's CDC guidelines that they issue as far as mainly one of the main things that they use to determine that is the risk of acquiring the virus in a communal setting. So if you're out at a store or out in public, what is your risk of acquiring that from other members of the public around you? And right now we still consider that mild to moderate. Hopefully very soon we'll be able to drop that down to mild. We still want to get through this possible Easter impacts, if you will. It's kind of what we're looking at right now. So those are the one things we're looking at. Hopefully we're sitting at right now, I guess, 8 days post-Easter. So in the middle of this week we'll be at 10 days. And that should give us a pretty good idea if there's significant impacts due to large community gatherings in the public. So hopefully we won't see an impact and a rise in cases, but we are looking at that and as a possibility for sure. Obviously one of the reasons we continue to see relatively low numbers and a relatively level new case counts coming daily. I think the last large increase was back on April the 13th. Actually, maybe April 17th, we had I think 5 new cases that day. But we've stayed pretty consistent. We think it's because of the social distancing and protective measures we put in place, and we've advised the public. Obviously, just on being out in public a little bit at the stores myself this weekend, I think we can do a better job. I think there's obviously some room for improvement there. Hopefully people will continue to adhere to the guidelines and a little more stricter, wearing masks more so in public. Just keep in mind in those stores, sometimes it gets a little tight down aisles and things. Hopefully we can try to be more cognizant of that and keep our distance from one another when we're out there. That'll definitely help on possible continued community spread and reducing that. Want to kind of move on to testing a little bit. We have some updated numbers over the weekend that we got this morning, so we appreciate the labs getting us that information today. We're looking at 1,150 tests done to date. We had about, Friday's numbers were at 1,080, so we've done about 70 over the weekend. And as of this morning, we had about 12 of those pending. So we see there's the testing demand I wouldn't consider very high. There's 70 tests over 3 days is not a whole lot. We also, over the weekend, were able to reach out to hospitals, some labs and clinics to really identify what is out there as far as testing capacity, how many tests are available. And our best guess, reaching out to those different agencies and departments, we're guessing about 1,500 tests right now available within Victoria County. That may vary a couple of hundred here and there, but that's our best guess, and that's actually a little low, I think, estimate on our end, but we want to be kind of on the low end when we're looking at that. As I mentioned on Friday, I touched a little bit on how Victoria compares with the state. Right now, we're still holding about double state average as far as the amount of testing we've done here, I guess, per population. So that's an encouraging sign as far as our efforts to make sure we brought enough testing to the public, make sure it was sufficient enough. And again, just to point out that we did on Friday, the closing of the community testing site was no indication of a lack of testing. There are some indicators that some testing supplies on a national level coming down to local labs may be a little restricted. So we went ahead and were a little proactive on that, and we didn't want to keep pushing a lot of those tests and taking them out of hospitals and urgent care clinics and doctors' hands by continuing that testing site. Obviously, we had some concerns with PPE usage and things of that nature. We thought we could adequately satisfy the testing needs of the public through their continued visits to the physicians, to urgent care clinics, hospitals, and I think we were right on with that. And I think there's still everyone that was been identified that we can find out that needing a test and that met the guidelines for doing so have gotten a test. And keep in mind, a lot of that's going to be in the physician's hands. So if the physician deems necessary that you will need a test, then they'll do their best to make sure that that happens. Going on with the need of testing, the perceived lack, one thing we're seeing is some employers that are requiring employees to get tested before they go back to work. We don't encourage that. Department of State Health Services has actually issued guidance on that as well. The reason for that, and we've talked about this in weeks before, you don't want to run into the issue of false negatives, where if you have an asymptomatic person present for a test, they get the test completed, maybe a week later they do develop symptoms, and then all of a sudden they do have COVID, but they weren't identified in the testing because they weren't shedding virus at that point to where it couldn't show up for a test. So we're again, and even though we are good here locally as far as testing goes, tests are still a vital resource. So we don't want to use those on employees that may not even be symptomatic, have never been exposed, there's no risk level at all, wasting a test on those individuals to do that. So from DSHS, and I'll just read real quick a snippet from that letter that they had sent out. So DSHS recommends that mildly ill individuals who have symptoms of COVID, like fever or cough, stay at home and take care of themselves there. Many mildly ill people will not need to go to the healthcare provider for testing or treatment. Sick individuals can help prevent the spread of their illness by staying at home. And that's something we've identified and advised from the beginning. What they're trying to do is make sure that if there is a truly need, that comes from the physician itself, not by recommendations of an employer, just so they make sure they do get clearance before returning to work. Other than that, one thing Dr. McNeil had mentioned on Friday was that we are working on compiling a list of those facilities testing here in Victoria, and that has been completed. I was just waiting on an updated list, and I didn't get that quite before I came in, but I think we'll look at pushing that out on our social media and websites, and hopefully we can have a list of those facilities apart from private physicians' offices, such as any urgent care clinics, additional that we haven't mentioned before, that are available to do testing for the public, so they can have that in hand, and so they know where to go if there's a test needed, so that way people don't run into difficulty getting tested if need be. With that, I think I covered most everything. I will pass it back to Ashley.
Sure. So just want to touch again on some of David's key points. DSHS's recommendations to employers can be found on dshs.gov. Again, they are asking that if you have mild symptoms or if your employees have mild symptoms, please do not require them to go get a physician's order. Again, that's up to the physician. He or she will decide that upon visit to the office. So that being said, we'll open it up for any questions.
David, I just take it from what you said, there are no plans to reopen the mobile specimen collection site?
Not at this time. If we see definitely a need, one of the reasons we did open it, there's some difficulty we're finding with physicians' offices that may have not been wanting to expose their staff to patients. So we were trying to take that burden off of them to do that. We're just not seeing that right now as far as the need. If we do, definitely we can put that back on our plans and something we can look at, provided we have enough testing, which we do, as well as PPE and staff to do that. It's an obvious strain on resources when you're pulling already a vital resource out of healthcare facilities, both PPE and personnel, and then taking that out and put it in different locations. So we want to be cognizant of those facilities' needs right now in the hospitals and the urgent care clinics and things, both locally and regionally, to keep those assets there. And if we can go by the normal healthcare system and the I guess, lab capacity that's done on a daily basis, then I prefer to keep that route. I think that's more efficient and better off for everybody.
Do we still expect to see a peak or a spike in cases, or do we think that the number of new cases is leveling out at this point?
Yeah, I tend to be a little pessimistic, I think, so I'm kind of just waiting to see, especially of Easter. Hopefully we clear Easter without that, or not clear Easter, clear the 10-day incubation period, you know, assuming a day or two delay for folks to actually go get tested, and then a 2-day return. That's where this 10 to, basically 9 to 11-day number is coming from, that we're trying to wait out to see the results of Easter, because as you know, everything we do is about a week and a half delay on that, on results. So I hope we've hit our peak. I'm not going to say we have, because there's no way for me to know really. But I think the measures we have taken in place has hopefully put the peak where we're at or behind us. Looking nationally, we've been at pretty steady national new cases about the past 2 weeks. I think we've been averaging across the U.S. somewhere between 25 and 35,000, pretty solid for the last 2 weeks. So I don't really want to, that's an indicator for us, and that's something we look at for making decisions as far as how we move forward with things. So for us, that's pretty steady. And, you know, taking apart, you know, the outbreak, obviously at Pam North, I think we'd be pretty steady and pretty level off for the past 2 weeks as well.
Going off Pam North, can we get a quick current count for how many patients there was? Because I think there was there was 2 different numbers. I just want to confirm the patients at Pam North that were.
Yeah, and I think Dr. McNeil mentioned that that last Friday, and there was a little confusion. We track patients in that facility and outbreak a little differently, because we had, the confusion came from Victoria County patients versus out-of-county patients that were there. Last count, we had 10 patients total in that facility is what we're looking at. And that was both Victoria and out-of-county as well. But again, that could change. That changes rapidly. And I think this is updated today, but I would allow for some day or two discrepancy on that.
We had a day or two where we had a reprieve from numbers. We had 0 new cases. Now we're up to 7.
Well, today we've only had 1, and then we had 2 and 1 over the weekend, and 3 on Friday.
Okay.
Yep.
Do you have anything to say? Is there any a theory or any medical evidence that suggests that any of these have to do with Easter or a continuum of the PAM outbreak or?
Yeah, so what we're looking at, and when we do the case investigations, when the FE team does those case investigations, you know, we try to find ties, and we try to find things that are related, and what would tell us if, okay, are these folks been around Easter? Is there any indication? And from the investigations, we have not, and we haven't identified everything. But keep in mind, just with any investigation, the information that you're at your fingertips is only as good as what's provided to you. So again, we're hoping that everybody's completely open with us, because all we're really, our main goal is just to identify whoever may have been close contacts, whoever's high risk. We're not trying to get after anybody. We're not going to go, I'm not going to go write them a ticket. I can't anyway. If they're around for Easter, that's not, I'm not worried about that. I'm worried about the public health. Make sure we identify any of those contacts and isolate those individuals as well. So we encourage those going forward. If any of the folks, you know, out there listening, obviously they become positive, just be as open as you can. It's not to really come down on you or write you a ticket. It's really just to protect those in the community and those around you.
Now, you had mentioned the tipping. You had mentioned from mild, moderate to mild. I read a bunch. Help me to make sense of what you consider in your numbers. What would take us from moderate to mild?
Yeah, so it's a tough, there's no really exact answer to that. I really lean on a very vague, purposely, I guess, clarification or identification of that. And that's really the risk of communal or exposure in a communal setting. So at this point, it's, you know, we're going to factor in new cases. We're going to factor in recovered numbers. We're going to kind of put aside the outbreak a little bit in that sense, because that was a contained. But again, you know, cases may still pose a threat outside there. But, you know, just going back to CDC clarification on that, right now they classify minimal to moderate as widespread or sustained transmission with high likelihood or confirmed exposure within communal settings with potential for rapid increase in suspected cases. That may be a little more than I think we're at right now, but I'm not comfortable dropping it down completely to none to minimal is their other classification. So I'm just being very careful not to drop it too low, and then we, you know, I don't want anybody to think we're at a level where you can just relax and go out and, you know, let your guard down in a
So in
sense.
your mind, it's not presented by numbers.
Correct. I think there's so many factors, because for us right now, I mean, we had 0 to 2 days, which is great, and we'll celebrate that every day. But then, just 2 case here, 1 case there, really tells a whole lot? Not really. I think it's not a major increase, in a sense. It's something we never want to see, in obviously any cases, but I don't think we're prepared to move up or down yet. Hopefully it'll be sustained. Hopefully we can look, past about 2 weeks out and realize, okay, yeah, now we're at the point we can comfortably lower it down. And that's when there may be some changes later on to different orders and things, but I'll let Judge and Mayor discuss that.
We do have time for one more question.
David, just quickly, the National Association of County and City Health Officials estimates that as we reopen the country, we would need another 100,000 workers to perform contact tracing. Do we have enough people to do this work here in Victoria as we start to reopen the community?
Sure, and I'm glad you asked that, because I was going to make a note to discuss that. So, do I think we do in the county? Yes, I do. I think we have a great team right now. We've got the epidemiologist, obviously Brittany, that we mentioned before, but then she has a great team behind her of health department nurses that are doing that. They do similar work on a daily basis with other communicable diseases, STDs, and things of that nature. So the nature of the work, for the most part, they're comfortable with, they're experienced in. We also have capacity to build that out even further. We reached out to different medical and health professionals, residents, doctors' residents. Also, we've made contact with both SO and the fire department, PD, to offer up investigators, because that's kind of the nature of their work anyway. They're comfortable with working in health protected information, then they have a great skill set to do investigations. So we're prepared to go that route as well and build that capacity out as needed. Luckily, and I hope it stays like this, we haven't identified the need to really pull those in. Discussions have taken place. Next step will be a little more training in case we perceive there's a need for that. But right now, luckily, I hope we don't have to call them, but the need is there. And we've prepared that about a month ago. We kind of discussed that and ready to move forward with capacity.
Okay, and then just really quickly, have any COVID patients been transferred to Pam North? And if not, do we still plan to use that as a COVID facility?
I need to double check on that as far as information releases, obviously, because it's a kind of a census release of data for a facility. But let me look into that, and I'll get back to you on that.
Great.
Thanks.
Thank you all for your questions. At this time, David and I will exit the room, and our judge and our mayor will be in shortly.
Good afternoon, ladies and gentlemen, and thank you for being here. For those watching online, thank you for your attention. As we have the discussion about reopening the economy, about returning to normal, and about striking the right balance in that effort, the pressing decision in my mind is not about what the best practices are for people to use to protect their health. That has long been established, and we've been talking about that for months. Hand washing, social distancing, following CDC guidelines. The question instead is, what of those guidelines should be reflected in our local orders as mandates? Mandates that, if violated, could leave you with a fine or in jail. Our goal has been to strike an appropriate balance. I've talked about balance, but in this decision, perspective is also critical. Last week, I made the comment that it was more likely that you'd die in a car crash on Navarro than from COVID-19. That was not a flippant comment, nor was it inaccurate. The purpose of that comment was to put in perspective the threat that this virus poses. 3 weeks ago, we had legitimate concern about our healthcare system being overwhelmed, about our hospitals being overrun with COVID patients. That, fortunately, has not happened. Instead of being overwhelmed, our hospitals have in many ways been underwhelmed, with nurses and medical staff having their hours cut, and some even being furloughed. A lot of leeway is given to myself as county judge and to the mayor to determine appropriate actions in time of disaster and crisis. which is appropriate, and I don't shy away from doing what needs to be done. This is the third disaster that I've declared as county judge. But in making the decision about emergency orders that affect people's liberties and lives, there must be compelling reasons and an imminent threat rather than mere possibility of something bad happening. I have issues with the executive order in place from the governor, the way that that is currently applied in our order, some concerns about the appropriateness of that remains 3 weeks after it was implemented. I believe that social distancing protocols are a better indicator of whether a business should be open rather than it being deemed an essential business. Indeed, the majority of our confirmed cases, based on the most recent information I've gotten, have been of individuals who are essential employees in industries and jobs that are considered essential. And I think that there are elements of our local orders and the governor's order that can be tweaked to better mirror the circumstances that we find ourselves in. I believe that all businesses that can and do practice social distancing deserve a fighting chance, and that they should not be penalized by virtue of falling in the wrong category of a list, an arbitrary list. I had anticipated that the governor's new orders last week would provide greater direction in terms of a reopening plan. It appears that that may be coming next week. But some things I'm looking at and some key decision points in my mind are ensuring that the local orders we have in place match the threat that we face, and that we weigh the most current information in making those decisions. Like I say, 3 weeks ago plus, when we were formulating the orders we have in place now, there were a lot of unknowns. That we now know. There were concerns that we had that have not materialized. One legitimate undertaking we have right now is to continue to monitor possible effects from Easter weekend. Yesterday was 1 week since Easter. This Wednesday will be that 7 to 10 day window where you can kind of gauge if a community's activities led to a spike in confirmed cases. But thus far, we have not really seen that effect from Easter weekend. So looking down the road, looking at a reopening plan, I think a phased approach is appropriate, but I think in the early phases of that, and certainly compared to what's in place now, I think there's steps that we can take to better accommodate our small business owners that have been hurt in all this. Some examples that jump to mind, a jewelry store, for example, an antique store, a mattress store, a furniture store that doesn't sell appliances, and many other examples. Those are small businesses that seem to me as being unnecessarily closed in all this, that if they practice social distancing should be opened. So as we look at next steps, as we look at reopening, those are some things that weigh on my mind in terms of what our local orders should look like. In no way do I want to diminish our effort to control the spread of this virus, but at the same time, balance is also important, and like I've said previously, we can't allow our effort to control the spread of this become the enemy of everything else that is important and that we value in our community. So those are a few thoughts there that I'm weighing in making these decisions. Those are discussions we continue to have every day. I think the coming week will be important in us being able to determine what our next steps are. Certainly, we continue to look to updates from the governor's office as to his plans, but more so than what is handed down from Austin or Washington, more important in my mind is our local conditions that we are actually encountering, the conditions that we reasonably anticipate encountering, and the feedback and advice of our local medical health experts. So that's what I'm looking at most attentively. I don't think it's essential that we be in lockstep with everything that we get from Washington or from Austin, frankly. But we do, we are monitoring what they say because that certainly does impact us, especially so coming from the governor's office, since the governor, in fact, is able to supersede our local orders with his own, which the president doesn't do. So we'll continue monitoring that. Again, I think the week ahead will be a very pivotal time in us determining what the right next step is. But I wanted to share with you the thoughts going through my mind as I make those difficult decisions. I'll turn things over to Mayor McCoy now for some comments.
Thank you, Judge. As the judge stated, we will reopen our local community in a safe and structured manner, and according to the advice and recommendation of our health experts, including our public health authority and our public health department, as well as state and local resources. We phased our way in, and the intent still is to phase our way out, because we want to ensure that we're reviewing the appropriate data and following the President and Governor's gating criteria as reasonably we can. And I would like to state the frustration that I think the judge has stated too, with some of the definitions of how businesses should or should not open. I don't disagree with the judge that sometimes the difference in essential and non-essential isn't, but I think we need to be prudent in the way that we do our orders, so that what we put in place doesn't appear to be inconsistent with the governor's orders, more so in the legal structure of it than the intent of it. But it is very frustrating to me, and as a matter of fact, I was on the phone yesterday afternoon with Representative Morrison. I've spoken with Senator Colkhorst 3 times today, 2 individual calls, and on the last one, the judge joined me as well. And I do have some concerns with the fact that that TDEM, Texas Department of Emergency Management, is supposed to be taking recommendations from different businesses as to whether they could be added to, quote, an essential list. And I have not heard or seen any data out of that group at all. So I expressed my concerns, especially to Senator Colkhorst today, that I would like to see some information out of that office, because I want to see what businesses might have asked to be classified as essential, and then if they were okayed, I want to know that. But just as important, I want to know those that were denied, so we can get a handle on what all this means as we move forward with our local orders. Because I can assure you that our intent is to open up our businesses as prudently, as quickly, and as prudently as possible. And I think that goes without saying, and I think the judge and I are on the same page in that regard, because we cannot allow our economy to die. I mean, that is essential. I mean, we talk about trying to create businesses in our community right now. We've got to keep the businesses that we have here viable, because if we've got to then be tasked with replacing those that we've lost plus adding to them, that's a daunting task. And so we need to keep that in mind. And I think there are ways that we can do it safely and with the assurances of our public health director and our health authorities. We just have to be smart about it. And And at the end of the day, we can talk about whether we mandate, whether we ask, and gosh, I don't know how many times I have to say this. I've said it, what is it, Judge, now 7 weeks, almost 6, 7 weeks since we began all of this. And I've said it all relies on people's personal responsibility. You know, you have to be responsible for keeping yourself safe, and you should take the responsibility upon yourself to keep your neighbors safe. And that goes without saying, because none of this is going to work unless our community buys into it and understands what it is that we're trying to do. And that the community has to trust that we're doing the best we can, given the information we have, and to open up our city again. We must do that. We have to. And it's like I said, you will never see a situation where our streets will be totally bare. That is never going to happen. And people talk about this virus. We're going to have to learn to live with this virus because it's going to be with us. Okay? It is going to be with us in one form or another moving on. And we can't become paralyzed in everything we do out of fear of this virus. It's like all the other viruses, all the other flu viruses, all the others that we've dealt with before. They come, they go, but they're still here. That's why we have vaccines for them, and that's why that we learn to deal with them. The panic in all of this was created because this was a new virus, and no one knew much about it. But I think we can all say that as we've watched things unfold, that we've all learned, we all know a lot more about this virus today than we knew 6 weeks ago. I think that's a given. And I think we see it on national news. We see it in local discourse. We see the numbers bearing that out. Now, there's varying agreements and disagreements about the totality of those numbers, but I think in general, everybody agrees that it's not as bad as was first anticipated. So I think that's the framework in which we're going to move forward, the judge and I. And we have I'm not going to call them heated discussions. We have very serious discussions about this, as well we should. These are important decisions that the judge and I have to make. And unfortunately, we're the two that have to make them. And that's because of the positions that we chose to put ourselves in. And I don't think either one of us has any problem in making those decisions and working together to the extent we can to do what's best for this community. You want to open it up?
What questions might any of you have? Yes, ma'am.
Okay, so let's talk about, without putting pressure or specifics on dates, but, you know, Governor Abbott has said today, the 24th and the 27th,
Mm-hmm.
for certain things that he is
Mhm.
going to open up.
Mm-hmm.
For our community and for our public, what dates are you guys looking at to make some decisions, some adjustments, if you
Mhm.
will, or some mandates?
Mm-hmm. You know, like I had mentioned, continuing to see if there is that Easter spike that was anticipated, continuing to look at the numbers through the next couple days. I mean, it was a week yesterday, going through Wednesdays, 7 to 10 days. So if there's not a big spike there, that will be a good thing, a good sign. You know, it is hard to put a date on that. I know you didn't ask for a date, but I would tend to think, in general, sooner rather than later, we would see the first and new steps of a phased approach. Of the phases laid out, I think we'll see the first one sooner rather than later. That may not answer your question, but again, we are looking at data over the next couple days in terms of new case counts possibly. But then also it is important to see what next steps the governor does lay out, because there is a window of flexibility we have in our own orders to be different than what the governor has in place. In some instances, being more restrictive, in some instances possibly being less. So we do have a window of flexibility. I've said that I want to use our local ability, that realm of options we do have, to the extent possible that best addresses the needs of our community. It's hard to not be able to give a time frame on that, but our current orders are set to end on the 30th. I think it's quite possible that we would have them adjusted prior to that. Possibly by the end of the week, if local conditions warrant that, if the expert advice that we look to, accounting for all those things, that's a possibility.
Well, I think we know what the governor's gonna do on the 24th because it was in his order. He's gonna put in the curbside retail
Correct.
business.
Correct. And then on the
that's the
20th.
essence. And the 27th is the one that we're really waiting
Right.
to know what he's
That
going to do.
sounded like that was going to be an announcement. Well, the announcement on Friday was basically an announcement that there would be an announcement on the 27th
Right.
for action to be taken at some point in May.
That's how we understood it.
That's essentially what it was, aside from the news that schools would be closed through the remainder of the
Right.
school year and that state parks would be opened today and that curbside retail would go into effect Friday. The next big thing will be whatever announcement's going to happen a week from today. I don't know what that's going to be. The tone and the impression I got in both the press conference on Friday and then in the conference call the mayor and I and other mayors and judges across the state had was that it would be announcing a change at some point in May. I don't know that Monday would be big new things happening right then on the 27th. But we'll continue to analyze that. And again, to the extent we legally can, I'm more interested in taking steps, looking at our local conditions rather than mirroring exactly what's being mandated statewide. Our community is different, our needs are different, our geography is different. We have to weigh all that into account. We're not New York, we're not even Houston or San Antonio, or Austin. But there are a lot of elements to consider in these decisions, and we do our best to consider them all and balance them appropriately.
But we are unique. We're the center of an area, region here, and we talk about ourselves being in a region. I think we're very fortunate. We have resources that others don't. I was on a conference call today with other mayors. It was quite evident to hearing their comments and everything that we should be very thankful that we have the resources we have. I know people talk about testing. I gave statistics last week that we're testing at over twice the state's testing level. And so I think that's one of the reasons that we tend to know more about our numbers than others do. I listened to other the comments about, other areas not having numbers. We have an epidemiologist that many places don't have. We have a public health director, which other smaller counties and areas don't have specifically. So we have a lot of resources. We have excellent medical services in this. That could very well be why we have such a high recovery rate, quite frankly. So we have a lot of things going for us, and we should be thankful for that, quite frankly. There's a lot of positive things going on in Victoria that we should be thankful for. And I think we have a lot more information in our hands than many of our colleagues do in smaller cities and areas throughout Texas. So let's be thankful for that we do have a lot of information, and that information is power, and knowledge is power, and it's going to give us confidence as we move forward in opening up Victoria again, because I think we'll feel a lot better about the decisions we make knowing they're backed with solid science and solid data.
What other questions might there be?
Both the president and public health experts have recommended that the number of new cases in an area be declined for 14 straight days before communities consider reopening. Is that a guideline we would expect to follow here?
Not necessarily. From my perspective, not necessarily. We looked at a lot. A number of new cases is certainly a critical factor, but also the details of those cases. Like we've said, is that community spread? What do we know about those cases? So are we committing that we're going to follow the president's guideline exactly, the 14-day? I don't know that I would commit to that. Those are key factors that we analyze and study constantly on a daily basis, but I wouldn't commit to that there's going to be 14 solid straight days of declining numbers. You know, I think, as the mayor mentioned, this is something that will be with us a while, that will reoccur in all likelihood regardless of the steps we take. And so, you know, that weighs into my mind also. Knowing that it's something that's going to be with us, there could be some seasonality to it, like the flu, like with other viruses. That does play a part in my decision-making as to what steps we should take now. If we know this is going to be with us in the fall, we certainly can't have businesses closed till the fall. Even the measures in place now are sustainable only for so long. So I think those were our guidelines. Certainly what the president outlined was a guideline. It's not a mandate. And I think we'll largely operate within those guidelines, but they're just that, guidelines, and they may not exactly mirror the steps that we take locally.
Just, you know, we've talked a lot about Easter and how that one day can affect our overall count. I mean, how do we know that once we begin loosening the guidelines, what protections are in place so that we don't see a huge spike of cases as soon as we begin reopening the community?
Mm-hmm. Well, I think the protections that we have are really the things that we have emphasized all along. Being responsible, if you're a person in a high-risk category, to stay home, but also the social distancing, the hand washing, all those things. Those are the tools that we have to use, and they're very effective. So I would continue to emphasize those things, and whatever the phased approach that we roll out looks like, those will be key elements of that, and really those are tools available to every single person in this community that they ought to be used.
And honestly, you know, I think that's a concern nationally. Everybody knows there's talk in most areas about the need, even in New York, to open up and start trying to function again. And I think everybody's concern is always about the unknown. You know, you've got to be prudent about it and do everything you can to preclude spikes, but there's no guarantee. There's never a guarantee in life, period. So you have to be willing to move forward in a structured way, and if you see these spikes occurring, then you adjust. But for us to sit here and use that as an excuse to do nothing is not very wise. I mean, you know, if we're all looking for the day that there's not a single case, that's a long way off, in my opinion. And you can analyze the numbers. I think the judge did a very good job in talking about the overall numbers. We just have to be smart about it. And we can't be terrified about it. We can't be paralyzed with fear. Fear should be used as a way to heighten your awareness, make you more cautious, but it should never paralyze you. Because when you end up doing nothing, it puts you in far more peril than to just ignore the thing that makes you fearful, okay?
Yeah, and one final thing in closing, Kira, to your question about seeing the 14-day decline. Really one of my primary concerns early on, 3 weeks ago, a month ago, was our hospitals being overwhelmed, our healthcare providers being overwhelmed, them being exposed to the virus, having to be taken out of the equation to be in isolation while they recover, or worse yet, coming back as patients. That threat has not materialized. The current levels of exposure cases, our medical hospital infrastructure is very much able to take care of. We've got 12 folks in the hospital, which we'd like to have 0, but our hospitals in Victoria can accommodate 12 sick patients. As of last time I checked, we had 3 in ICU. We have dozens of ICU beds. Empty ICU beds is a good thing, but what I'm saying is that even at current levels, without seeing a 2-week decline, if current levels were maintained, that's nothing overly straining on our medical infrastructure, on our hospitals, which was a big concern early on, and that's just a concern that has not materialized. Okay, we got time for one more. I know we're running late.
Okay, so I would love to know if you guys would speak directly to a small local business. What advice would you give to them right now? They're not an essential business in a hurry.
I would say to that small business owner, it is my hope and my goal that orders will be tweaked as soon as possible to enable everybody to open up on the basis of whether they can effectively social distance rather than on the basis of whether they were on the wrong category of an arbitrary list. The essential, non-essential distinction was ushered in statewide by the governor's office. At the time, it may have been appropriate, but I think as we daily get new information, the applicability of that in light of our current circumstances is less and less fitting. That's something that I would like to see changed. I can't give you a timeline on that, but that's how I would communicate to that business owner.
And from my perspective, I would say tune in tomorrow night to the city council meeting, where we're going to be discussing specific ways to hopefully help our small businesses. Okay? So we do take it seriously. You know, small business is the lifeblood of America. It is the lifeblood. It's not the big businesses. It's the medium to small businesses. Without those, America cannot function. Okay?
Thank you all very much.